A new survey on attitudes about sex within the Latino community. A look at what those teenagers think and what the numbers show. At first glance, the numbers seem almost unbelievable. In fact, more than half of Latinas become pregnant as teenagers. And our senior medical correspondent, Elizabeth Cohen, is looking beyond those numbers. So what are you finding? First of all, that's a really old number, a really old statistic.
Right,
yes?
Right. It's a really old statistic that approximately 53% of Latinas get pregnant before their 20th birthday. The numbers have changed a bit, but the general bottom line is that there is a concern that there is a high pregnancy rate among Latina teens, higher than among non-Latinas, than among, for example, whites who are not Hispanic or among African Americans. So this is the concern, is that pregnancy rates among Hispanics are not going down in the same way they are for other groups. And so there's a group right now that is meeting right now. It's a national pregnancy prevention group, and they're meeting to try to figure out what they can do, because what this survey found is that Hispanic teenagers say that they want to achieve important life goals like getting an education and getting a good job. They say 8 out of 10 of them say that's important, and that they know that having a baby interrupts that. They know that, but still the pregnancy rates are pretty high.
Yeah, so everybody probably wants to know why those numbers are so high, and then we'll get to the new information in the new report. Why do they think the numbers are
there are lots of theories out there. There's no sort of one reason. This is what they call in the biz a multifactorial problem. For example, when I asked the author of the report, why are these rates so high, and she said that pregnancy prevention programs are not culturally sensitive to Latinos, and they therefore don't resonate with Latinos. Other reasons that other people have cited is sort of the Catholic prohibition on abortion and birth control, and also just sort of a cultural issue with discussing sex, that there is sort of more of a problem of parents discussing sex in the Latino community compared with other communities. So those are just some of the reasons that are cited for this relatively high rate.
Okay, so what does the new report show then?
What the new report shows is that there's sort of a disconnect between the beliefs in the Latino community and what's actually happening. So what the report showed is that 8 out of 10 Latino teens, they surveyed 759 teens, and 8 out of 10 of them said education's important, getting a good job is important, big life goals are important, and we know that having a baby as a teenager gets in the way of those goals. So that's the belief, but what's happening sort of on the ground, so to speak, is that the Hispanic teen pregnancy rate is relatively high. So they're trying to figure out how do they sort of make more of a connection between the beliefs and the reality.
Okay. Well, obviously, it's a very thick study. So
it's a thick and a very important issue. A lot of people are really working hard on trying to get these pregnancy rates down.
All right. Very good. We sure do appreciate it. Our senior medical correspondent, Elizabeth Cohen. Thank you, Elizabeth. Now let's turn to a leading expert on Latina health issues. Dr. Jane Delgado is joining us now with a little bit more perspective on this. She is the president and chief executive officer of the National Alliance for Hispanic Health. So thanks for being with us, Dr. Delgado. I appreciate it. What do you make of this report?
Well, I think it shows what we all know, that knowledge, attitude, and behavior are 3 separate things. People may know the facts, they may have an attitude, but it may not show in their behavior. So we really have to see what are the other messages that we're giving young girls. And I think between 1980 and now, the number of advertising to girls that exposes them to being more sexual is very high. So it's not just what's happening in the Hispanic home, what are the messages girls are getting? Plus, remember, boys are part of the equation.
I was just going to say,
exactly.
It takes 2 to tango.
Exactly. And too often, what we've done is give one message to girls and another message to boys. And the data clearly show that girls who have partners who are older than them, as that age increases, the likelihood that they engage in sexual activity early goes up. So there are lots of things we have to do, and of course we do different things at different times. We also have to let parents know how do they talk to their children. You know, I'm a parent. I know don't talk to your child until they're a teenager about sexuality. Start early. And you do it for their level of development so that by the time they're a teenager, you as a parent have a credibility to talk about things which are sometimes difficult. You also have to model the right behaviors.
Yeah, no question about that. When we look at this particular report, though, and I'm not sure if you've had a chance to go through all of it, it is quite lengthy. What about that relationship between the parents and their influence over kids when we're talking specifically about sex and about contraception, too?
You know, it's one of the things which is very important, and what parents teach their children is key. And we know from literally 25 years of research that if parents focus on education, since children are younger, especially girls, that they're more likely not to engage in early sexual activity and get pregnant. And also remember, the Hispanic data, actually the teen pregnancy rate for Hispanic girls has gone down since 1981. It was always very high, but it has gone down. And I think the messages we give parents, partners, and other adults are key.
Yeah, absolutely. In fact, I want to read you something in this report. It says Latino teens in this survey report that the most common reason why teens do not use contraception is because they're afraid their parents might find out. The second most common reason cited by Latino teens is a lack of knowledge or education about contraception.
Well, knowledge about contraception is not enough, because knowledge is one thing, against the thing of whether or not you use them. We also know that over half of Hispanic teens do use some sort of health services, and their parents know about it. So that there is a disconnect between use and knowledge. And I think that's what we need to create the environment, especially for young women, where they are more proactive in saying what are their needs. Also, remember, these older men who are the ones who are often the partners of these younger girls, they need to have some sense of responsibility, understand that its sexuality is more than pleasure. It's also about responsibility, about potential parenthood, and other things if there is no kind of birth control that's used.
All right. Well, we sure do appreciate your time on all of this. Dr. Jane Delgado, thanks so much. And I don't think we have said the name of the study, the National Campaign to Prevent Teen and Unplanned Pregnancy. It's called Toward a Common Future. Thanks so much. Appreciate it.
You're welcome, Heidi.